Hello everyone, today I will introduce our recent work which has been submitted to iMeta, entitled Nationwide Profiling of Vaginal Microbiota in Chinese Women Reveals Age-Dependent Shifts and Predictive Biomarkers for Reproductive Health. The vaginal microbiome plays a critical role in women's reproductive health. In this study, we profiled the vaginal microbiota of over 6,000 women covering 38 study centers and 18 provinces across China. We investigated the associations between vaginal microbiome and a wide range of host factors, including demographic and geographical characteristics, lifestyle, reproductive history, medication, and disease history, as well as vaginal and cervical clinical symptoms. In this study we aim to provide a comprehensive understanding of the role of vaginal microbiome in reproductive health among Chinese women. We assessed the associations between host features and vaginal microbiome characteristics, including beta diversity, Shannon diversity, and the abundance of 31 core species. Symptoms showed the strongest associations, followed by demographics and lifestyle. Top features with the greatest number of associations included condom use, age, number of sex partners, vaginal itching symptoms, and middle education level. Aging is a well-known driver of changes in the human microbiome. We identified that Shannon diversity and several species presented significant nonlinear associations with age, with a notable shift around age 40. These results indicate that the early 40s represent a critical for microbiome remodeling. Most differential bacteria showed consistent links to clinical symptoms and vaginal pathogens, enabling definition of a healthy vaginal microbiome signature. Using a log ratio of healthy enriched to healthy depleted taxa, we developed a vaginal microbiome balance score, BS. The balance score was significantly lower in unhealthy individuals, including those with sexually transmitted infections, symptoms, or vaginal diseases. To evaluate the reproducibility of the BS, we validated our findings in publicly available vaginal microbiota sets, and the score can be replicated in most datasets. We further examined whether the baseline BS predicted the progression of vaginal health outcomes using longitudinal data. A higher BS was significantly associated with a lower risk of BV, Mycoplasma hominis, Trichomonas vaginalis, and Chlamydia trachomatis at follow-up. In summary, we characterized the vaginal microbiota of 6,423 Chinese women of reproductive age across 18 provinces and assessed associations with 33 host factors. We observed a striking compositional transition around age 4, marked by declining Lactobacillus crispatus and enrichment of dysbiosis-associated taxa including Gardnerella vaginalis. Sexual behavior, contraceptive use, and education emerged as key determinants of community structure. We derived a microbiome score, validated it in external datasets, and demonstrated its predictive power for incident bacterial vaginosis and sexually transmitted infections.